Hi everyone and welcome back to the channel. For those of you who are new here, my name is Dr. Francis and I'm a board certified OBGYN. I've been practicing obstetrics and gynecology for over 23 years now, and over the course of my career in private practice, I've had the privilege of delivering almost 6,000 babies. And before that, I spent 4 years in residency where I delivered about 2,000 more. So you could say I've been a part of a lot of birth stories. Today we're going to dive into an important and sometimes confusing topic in pregnancy, and that's genetic screening. Now I know this can sound overwhelming. Genetics, chromosomes, DNA, it's a lot of science, but my goal is to break it down in a way that's clear, easy to understand, and most importantly, helpful for you as you navigate your pregnancy journey. By the end of this video, you'll know what genetic screening is and why we offer it. 2, who should consider genetics testing. 3, the different types of tests available, including one that many people are most curious about, and that's the NIPT, or Non-Invasive Prenatal Testing. How the NIPT test can tell you the baby's gender, and finally, when insurance may not cover these tests, so you know what to expect financially. So grab a cup of tea, get comfortable, and let's get into it. First of all, what is genetic screening in pregnancy? Genetic screening is essentially a way for us to look at the baby's DNA, chromosomes, or certain risk factors to see if there's a higher chance of a certain genetic condition. Now the key word here is screening. Screening doesn't mean diagnosis. A screening test can tell us if there's a higher or lower risk for certain conditions. It doesn't definitively say whether the baby does or doesn't have this condition. If something comes back abnormal, then we usually follow up with a diagnostic test, which is more conclusive. Why do we even do this? Well, every pregnancy carries a small chance of certain genetic conditions. Most babies are born perfectly healthy, but we know that some conditions like Down syndrome, trisomy 18, trisomy 13, and certain inherited disorders can happen even when there's no family history. Screening just helps us gather more information. So who should consider genetic screening? You might be wondering, do I really need this, and who is this for? The truth is, genetic screening is available to all pregnant women. It's not limited to just high-risk groups anymore. That being said, some women are more likely to consider or benefit from it. And here are some examples. 1, maternal age. If you're 35 years or older at the time of your delivery, your chances of having a baby with chromosomal abnormalities like Down syndrome are higher. We often recommend screening more strongly in these cases. 2, family history. If you or your partner have a family history of a genetic condition like cystic fibrosis, sickle cell anemia, or muscular dystrophy, screening can help to see if your baby is at risk. And 3, ethnic background. Certain genetic conditions are more common in specific ethnic groups. For example, Tay-Sachs disease is more common in the Jewish population. 4, previous child with a genetic condition. If you've already had a child affected by a condition, it makes sense to do more thorough testing in future pregnancies. And 5, just wanting reassurance. Many patients, regardless of age or history, simply want more information. They find peace of mind in knowing the results, even if the risk is already low. So while some women should really consider it more strongly, any pregnant woman can choose to have genetic screening. It's ultimately about what feels right for you and your family. What types of genetic tests are available? All right, let's break it down. The actual types of tests, because this is where patients often get confused. First trimester screening. This is an older option but still used in many places. It usually involves a blood test from the mother combined with an ultrasound measurement of the baby's neck called nuchal translucency. This can screen for risk of Down syndrome and trisomy 18. The pros, it's done early, usually between 11 and 13 weeks. It's non-invasive, just a blood draw and ultrasound. The cons, it's not as accurate as newer methods like the NIPT test, and it's a higher chance of false positives. Second trimester screening like the quad screen. This is a blood test done between 15 and 20 weeks. It looks at 4 different substances in the mother's blood to estimate the baby's risk of certain conditions. The pros, it can give information about neural tube defects like spina bifida, in addition to chromosomal risk. The cons, again, it's less accurate than the NIPT test, and it's later in pregnancy, so less time to make decisions. And 3, carrier screening. This one's a little different. Carrier screening looks at the parents, not the baby. It checks whether you or your partner carry certain genetic mutations that could be passed on. For example, if both parents carry the gene for cystic fibrosis, there's a 25% chance the baby will have it. Carrier screening can be done before the pregnancy or during a pregnancy. And 4, diagnostic tests like CVS or amniocentesis. These aren't screening tests, they're diagnostic. CVS or chorionic villus sample is done between 11 and 14 weeks and a small portion of the placenta is taken. Amniocentesis is usually done between 15 weeks or after, and a small amount of the amnio fluid is drawn. These are very accurate, but they are invasive and carry a small risk for miscarriages. 5, the game changer, and that's the NIPT or non-invasive prenatal testing. Now let's talk about the one that has become the most popular in recent years, and that's NIPT. NIPT is a simple blood test, usually done as early as 10 weeks into pregnancy. What's amazing about this is it looks at tiny fragments of your baby's DNA that were floating around in your bloodstream. By analyzing this DNA, we can get an incredibly accurate picture of the baby's risk for certain chromosomal conditions. What does it check for? Down syndrome, trisomy 18, trisomy 13, some sex chromosome conditions like Turner syndrome or Klinefelter syndrome, and in some expanded panels, even microdeletions, though this is more controversial because the accuracy isn't as strong. How accurate is NIPT test? Well, NIPT has very high detection rates for Down syndrome, over 99% sensitivity. That means if a baby has Down syndrome, the test will pick it up almost every time. For trisomy 18 and trisomy 13, the accuracy is also very high, though not quite as high as for Down syndrome. False positives are rare, but they do happen. So if the NIPT comes back positive, we always recommend a CVS or amniocentesis before making any decisions. One of the most exciting and sometimes unexpected benefits of NIPT is that it can also tell you the gender of the baby. Because NIPT analyzes the baby's DNA, it can detect whether there are Y chromosomes present. Even if a Y chromosome is detected, you're having a boy. If not, you're having a girl. This can be determined as early as 10 weeks, which is much earlier than the typical ultrasound around 18 to 20 weeks. For many parents, this is a really fun part of the process. So now we have to talk about when insurance may not cover genetic screening. So let's talk about the not so fun part, insurance coverage. In many cases, insurance coverage, it will cover the genetic screening, especially if you meet certain criteria, being 35 or older, having an abnormal ultrasound finding, having a history of a baby with a genetic condition. However, if you're considered low risk, for example, under the age of 35, no concerning history, sometimes insurance companies may not cover. And the out-of-pocket cost for NIPT can vary widely. I've seen it as low as $200 and as high as $800 to $1,000 depending on the lab and the patient's insurance. That's why I always tell my patients to check with their insurance provider before proceeding so there are no surprise bills. So why some patients choose testing anyway, even if insurance doesn't cover it? Well, many patients choose to pay out of pocket for NIPT because the information it provides is valuable and can bring significant peace of mind. For some families, knowing early allows them to prepare emotionally, medically, and even financially if a child may have special needs. For others, it's simply about enjoying the reassurance that everything looks low risk. So how do I counsel my patients? When I sit down with my patients to discuss genetic screening, here's what I usually tell them. First, you don't have to do this testing. It's an option, not a requirement. Second, think about how you would use the information. Would knowing this change your pregnancy decisions, or would it just bring peace of mind? And third, be prepared for the possibility of uncertain results. Sometimes we get results that are inconclusive or borderline, which can cause anxiety. Ultimately, the decision is deeply personal. My job is to provide the facts and support you in whatever choice you make. So the final thoughts, genetic screening in pregnancy has come a long way in the last 2 decades. When I was in residency, we mostly relied on first trimester and second trimester screens, which had decent information but weren't nearly as accurate as what we can offer today. Now with tests like NIPT, we're able to give families much more reliable information very early in pregnancy, all with just a simple blood test. But remember, These are tools to help you guide. They're not perfect and they don't define your pregnancy or your baby. If you're pregnant and considering genetic screening, I encourage you to talk openly with your OBGYN about your options, your insurance coverage, and most importantly, your feelings and values around this type of information. So what do you think? Would you want to know as much information as possible early in your pregnancy, or would you just prefer to wait and see how things unfold? Drop a comment below. I'd love to hear your thoughts. And if you found this video helpful, don't forget to like, subscribe, and share it with anyone you know who's expecting or planning a pregnancy. I post new videos pretty much every week on pregnancy, women's health, and everything in between. So make sure to hit that subscribe button. Thanks so much for watching, and congratulations to all of you who are on this exciting journey of parenthood.